In this video, we're going to talk about corporate-induced diseases. We're going to define what they are, and then we're going to show a model that illustrates how a disease really can be a corporate-induced disease, starting way up at the top at a very upstream level. So first, let's start with the definition. A corporate-induced disease is a disease of the consumers, the workforce, or community members who've been exposed to the marketplace, who've been exposed to the work site, or been exposed to something else related to a business, and the disease agents that are part of that process. So essentially, it's any disease that impacts an individual that starts and really originates from corporate activities. Now, a classic example of this would be exposure to environmental pollution, or the diseases resulting from environmental pollution. So, and these are news articles talking about pollution on wetlands, radioactive material, harm from coal power plants. So something like air pollution from coal-fired power plants is actually a corporate-induced disease. But what we're talking about here is a little more subtle than blatant pollution. We're talking about what's known as the epidemiological cascade, which is what this model is. And the idea that it's not just those environmental contaminants, but it's actually the decisions made by the corporations and the policies that are in place that they lobby for, which ultimately create conditions to support the generation of that disease. So for example, in the basic version of water pollution, of basically dumping chemicals into a protected area, what decisions have been made at the corporate level, what decisions were made at the policy government level to allow those actions to occur. So it's going more than just that proximate cause of disease. So let's go through each one of these steps and try to explain it in a little more detail. So political factors. This is the top part of the epidemiological cascade that tries to explain corporate-induced diseases. Political factors are the most upstream part of this process. This includes things like lobbying, campaign contributions, which political party is in power, which can have huge impact in terms of how industries are regulated and what is allowed and what's not allowed. Particularly here in the United States, there's a huge difference between when Republicans, who are very conservative, are in power versus when Democrats, who tend to be very liberal, are in power. There's also issue of, is it a campaign year? So is it an election year and people are trying to drum up votes or drum up donations to their campaign? And what is the precedent? Has the government tried to do something before, or are they trying to kind of reverse actions that have already been in place? All of these are considered political factors within the epidemiological cascade. After that come the policies themselves. So the discussions to create the policies are actually higher up on the list in terms of the whole upstream downstream approach than the policies themselves. And these policies are, laws, regulations, rules, however you want to phrase them, and how depending on where they come from, and occur anywhere from the federal level down to the local level. Sometimes there are neighborhood communities that can do this. Sometimes there's even international organizations and treaties that govern corporate actions. The next step down from the policies are corporate decisions, which occur within specific policy environments. And these corporate decisions focus on who's the audience of the product, what products are actually being made, how are they being manufactured, how are they being created, when are they sold, when are they available, how much they're going to be, and then what lobbying will we do? So there's a little bit of a feedback loop here. So at the corporate decision level, they're asking who are we going to lobby, but the lobbying activity that itself occurs at a much higher level. But these corporate decisions will impact who can be exposed to the product that is ultimately going to cause harm. At the next level down, we have corporate pressures on the environment. This includes everything from advertising and marketing, where the products will actually be available, not just the discussions around availability, how it's going to be promoted, where it's going to be placed, there going to be specific pricing promotions to maybe get it below market value or undercut taxes or something else. There'd be taxes themselves, and then are there other barriers to purchase? Now, barriers to purchase in terms of corporate pressures on the environment is important for a lot of illicit substances in this course, since they pretty much all have age requirements. So you have to be a certain age to buy alcohol. You have to be a certain age to purchase tobacco or to purchase marijuana in states where it's legalized. And those are barriers to purchase. There can also be time restrictions, date restrictions, day of the week restrictions. Those are things that are barriers to purchase, which may not be as obvious as some of the other corporate pressures that exist in the environment. Below that is actually the modified environment itself and other sales pressures. So maybe they've talked about doing price discounts, maybe there are price discounts in an area, but the actual modified environment is how much are those price discounts? Is it a dollar amount? Does it overcome the increase in cost that taxes implement? How many discounts are there? How many advertisements are there? And then how much product is actually available? Do you just have one liquor store in a town, or do you have a dozen in a very, very concentrated area? As we get lower and we move downstream, we have to now talk about actually consuming the product. So here in this course, we're talking about alcohol and drug policy. It's how much do you drink? How much do you smoke? How many marijuana edibles have you eaten in the last week? How much product is consumed? And then ultimately you have the disease outcome. Among the people who've used the product, how many are sick? Among drinkers, how many have a certain disease? Among smokers, how many have a certain disease? And is this the proportion of diseased individuals among the product users, among the alcohol drinkers, among the smokers, among the marijuana users, the same as what would be expected in a population who didn't use the substance? So is the number of liver cancer patients, for example, the same among alcohol consumers versus non-alcohol consumers? Is the lung cancer rate the same among smokers and non-smokers? This is the bottom of the epidemiological cascade, and ultimately what is most easy to measure. On that measurement note, the higher up in the cascade you get, the harder it is to actually get good data and measure it. So talking about the impacts of policies and lobbying activities and those corporate decisions that are really high up on the upstream level, how do you get that information? How do you quantify it? And how can you put it in a form that's easily relatable so you can do the statistics behind it to see if it's related to the disease outcome?